So what are the different categories of breast surgery?
There's really three main categories, Randy. One is wanting to enlarge the breast augmentation. Another is lifting the breast that has lost volume. And the third one is reducing the breast that's just too large and too heavy and too pendulous.
Okay, let's start then with the augmentation.
Okay.
A lot of questions here for augmentation.
Okay.
Over the muscle, under the muscle, what type of implant, where you place the implant. So let's start there.
Again, you can go to 10 different surgeons and you'll get 10 different opinions about what's right. I went to the source in my training. The reason that I went to Houston to train with Dr. Cronin is to sort all these things out. They can be complicated.
And he's the first person to ever do breast augmentation.
Correct.
Okay.
And in his practice and at that center, they transition from on top of the muscle to under the muscle. There's many, many reasons to go under the muscle, too many to really go into right now. But suffice it to say, it gives the most natural result. It gives the best ability to see the breast on a mammogram, that it not be interfered with on the film, and a long-lasting natural result so you don't see the implant. It's hidden and covered, and it looks absolutely, completely natural.
Now, there are older patients, younger patients.
Yes.
Are the patients getting older and older, younger and younger? It's becoming a very popular procedure.
It is a very, very popular operation. There's really two main groups that will want it or be interested in it. One is going to be the younger woman who doesn't have children, who just never had the size or the volume or the shape that she wanted. And then the other group is going to be the mom who's had a couple kids and lost volume, lost shape from having the pregnancies. And in both of those groups, they're both very good candidates and have great results from the operation.
Okay, now you go under the muscle.
I go under the muscle.
What are the benefits over going over the muscle?
There's three benefits to go under the muscle. Number one, the risk of becoming hard, of what we call capsular contracture.
Is that common?
It's common when it's on top of the muscle. I think it's 40 or 50% on top of the muscle.
Wow.
Under the muscle, it's about 5 to 10%. It's a big change, a big improvement going under the muscle in that regard. The second thing is the fact that the implant being under the muscle doesn't block the breast. So the breast is not touching the implant, and the breast can be visualized better on a mammogram or an MRI. And the third reason is the implant underneath the muscle is hidden. If you look at a Playboy magazine, most of those women have implants, and many of them have them on top of the muscle. If you can draw a circle around the implant, there it is sitting on the breast. It's on top of the muscle. It's basically under the skin. When it goes underneath the muscle, it's draped over and covered by muscle. It looks much more natural, softer, beautiful, and stays that way.
So to avoid that straight ahead look, you go under the muscle for a natural look.
It's very important. Going into the muscle is the single most important thing in my mind to get that natural, long-lasting result that's going to stay that way.
What about incision placement? I guess there are different ways. There are in the armpit, I guess in the crease, through the nipple area. What do you do?
I actually do all three, and I give the patient a discussion on all three, pros and cons and options, and basically allow them to make their own mind up. I happen to have my own preferences, and if they ask me my opinion of what I think
what
might be
is your
best for them,
preference?
I prefer the incision in the fold under the breast. It's very, very short. It's very tiny. It's the least intrusive. I don't particularly think it's a great idea to put a scar on the nipple or on the areola. You can lose feeling. You can lose the ability to breastfeed. It's invading or going into the breast and creating scar in the breast itself. I think it's better, in my opinion, to leave it alone, untouched. It's a place that is best not involved with an incision and a cut.
How do you help the patients determine what size? I guess implants come in different sizes.
Implants come in all different sizes, all of which I tell them I have in my operating room. I have them go on a quest. I want them to have some participation in the matter and in the decision. So they go out and they get some magazines, Playboy, Penthouse, Perfect 10, whatever they choose. I want them to bring in pictures of someone that's approximately their height, body weight, shape, that they think if they can look like that, they will be happy. I take those pictures, I put them actually up on the wall in the operating room on the morning of surgery. And the surgery is done in a way with a special table that I actually sit the person up in the middle of the operation. And I can put a different size implant as a temporary size on each side, and I'll switch them around. I have nurses in the room who've also talked to the patient, and we make kind of a group collective decision based on our discussion with the patient and the pictures. it's always right. I tell the patient they can worry about any number of things they choose, but not to worry that the size will be wrong. We get it right.
Okay, we've talked, I've interviewed you about facelifting and other procedures, and you consider yourself an artist. How much art is involved in a breast augmentation or breast enlargement? Is it just putting in the implants and seeing what happens? And are all surgeons placing them the same way? So how do you achieve a natural look?
There's art in everything and technical need in everything. And it's the same with breast augmentation, breast implants. We're dealing with a foreign object that doesn't really belong in the body. It's not bad for the person. It doesn't have health consequences to the person, but it's like a splinter or a piece of glass. It really doesn't belong in the body. So we're asking the body to tolerate it and accept it in a way that it lasts a lifetime. So it's very important how the surgeon does it. Technically, in terms of being gentle, of incision placement, of not using a lot of cautery or burning or injuring inside, of using antibiotics so that everything is absolutely sterile. Again, I'm obsessive compulsive about my surgeries, and I'm obsessive compulsive about the technique. So I wash my gloves with antibiotics, the implant soaks in antibiotics, the pocket is washed with antibiotics. The technique is really what makes or breaks. It's the devil's in the details, I always like to say.
Okay.
And that's what makes or breaks a great result with a natural breast with an implant.
Breast lift. Who's a candidate?
Anyone who has any type of loss of volume so that the breast is droopy, the nipples are pointing down, they've had weight changes so that the breasts are now loose and falling.
So after pregnancy, this is very common.
Big common categories. After they've had a couple babies, they've breastfed, breast big, breast small, and the skin just gives up, it falls, and everything is pointing south.
So this is something you could have a predictable result. You could pick them up.
It's a wonderful operation. It's very predictable. It's very artistic. We can talk about issues of the size of the areola, how high they want it, the shape and coning of the breast. There's a lot of things that are really very important that we can change and make beautiful with an uplift.
Okay, I have heard with a lift that you get a scar, an ugly T-scar. What are you able to do now to minimize that?
Well, there's two or three different ways of doing a lift. One of them is with a T-scar that involves kind of an upside-down T that goes into the fold. There are other techniques that I do that's simply what we call a lollipop, meaning there's a cut around the areola and then up and down. And then there's some techniques where we just can go around the nipple or the areola itself. In all three of those cases, the scars are going to be good because it is how the surgery is done in terms of technique and sewing and meticulous detail. But for a period of time, they are red. They have a little bit of redness. We have lasers and other techniques that we can offer the patients to allow them to accelerate the period of time when it's red so that it gets white and gets tolerable really quickly.
Okay, you do reductions.
Yes.
Tell me about the breast reduction.
Breast reduction, again, is a great operation. It is one of those operations that makes people feel better by making the weight of the breast better. Their posture gets better. Their ability to wear clothing is better. It really affects a lot more than just the aesthetics of making a pretty breast. So it's a very happy, very satisfied group of patients.